स्वास्थ्य के लिए किडनी के महत्व के बारे में जागरूकता बढ़ाने और दुनिया भर में किडनी की बीमारी और उससे जुड़ी समस्याओं की प्रभाव को कम करने के लिए हर साल मार्च की दूसरी गुरुवार को विश्व किडनी दिवस मनाया जाता है। विज्ञान और प्रौद्योगिकी विश्वविद्यालय मेघालय के सहयोग से आगामी पीएस संगमा इंटरनेशनल मेडिकल कॉलेज और अस्पताल ने 14 मार्च को प्रसिद्ध नेफ्रोलॉजिस्ट और ऑर्गन ट्रांसप्लांट विशेषज्ञ पद्मश्री डॉक्टर सर्वेश्वर सहारिया, प्रोफेसर दीप्ति देवी, पेट नेफ्रोलॉजिस्ट द्वारा प्रस्तुतियां और ज्ञान साझा करने के साथ इस विश्वव्यापी अभियान को मनाया। इस दौरान PIMC यूएस से प्रोफेसर चित्रलेखा बोरा भी शामिल थे। एनकेसी ऑडिटोरियम में छात्रों और संकाय सदस्यों की एक उत्साही सभा में बोलते हुए यूएसटीएम की प्रो वाइस चांसलर डॉक्टर सर्वेश्वर सहारिया ने कहा, क्रोनिक किडनी डिजीज या CKD वर्तमान में इलाज योग्य नहीं है। इससे लोगों को जीवन भर देखभाल की आवश्यकता हो सकती है। CKD हृदय संबंधी बीमारियों जैसे अन्य स्वास्थ्य समस्याओं को जन्म देता है, जिससे समय से पहले मौत या विकलांगता हो जाती है। उन्होंने कहा कि अगर समय रहते इसका पता नहीं लगाया गया तो ये किडनी फेलियर तक पहुंच सकता है और फिर जीवित रहने के लिए डायलिसिस या किडनी ट्रांसप्लांट की आवश्यकता होती है। अपनी प्रस्तुति देते हुए डॉक्टर दीप्ति देवी ने कहा कि CKD का वैश्विक बोझ 2040 तक मृत्यु दर का 5वां सबसे बड़ा आम कारण होगा, क्योंकि उपचार महंगा है। इस वैश्विक स्वास्थ्य महामारी की प्रतिक्रिया रोकथाम जल्द पता लगाना और हस्तक्षेप होना चाहिए। किडनी की बीमारी की सबसे आम कारण उच्च रक्तचाप, मधुमेह, किडनी की बीमारी का पारिवारिक इतिहास, मोटापा, उम्र आदि है। प्रारंभिक CKD में कोई लक्षण नहीं होती है। बिना किसी संकेत की किडनी की कार्य क्षमता 90% तक कम हो सकती है।
We know in children, obstructive uropathy and low birth weight children are more prone to develop chronic kidney disease at an earlier age. But nowadays, it is said that even the adolescents are having the metabolic problems like in adult, and so are they are also exposed now to obesity, to high blood pressure, to diabetes, leading to even there is increased incidences of adolescent age group in this.
And every year we celebrate. I think we should not use the word celebrate, but we try to make an effort to make people aware that what exactly the kidney problems are, how we are going to tackle, and what suggestion we can give to the medical profession, all the population, what we have can get educated about the prevalence of kidney disease and how dangerous it is. As Madam has said that there's a lot of ignorance about kidney disease all these years. And 2006, way back, when some of the group of the International Transplant Society, they realized that this is almost growing like a pandemic all over the country, all over the world. And if something is not done now, the things will go definitely go out of control, and later on it may not be possible to do anything. So with that intention, they started the World Kidney Day way back in 2006, and subsequently every year we conduct this program. Again, to our basic idea is to educate the public about the danger of having kidney disease, how it can be prevented, how it can be detected early, and of course, lastly, how it can be treated. Now, in this situation like this, the treatment should come in the last because our aim is here is not to treat kidney failure patient. Our aim here is to how to prevent so that they do not have to go to that stage where they need a very difficult and expensive and complicated treatment like dialysis or kidney transplant, which is not easier said than done. In fact, I came earlier here as well and talked to the others. Many of you may be there about the need of organ donation for transplant. I think that will be the last option in a situation like this. We don't have to go to that level. Our aim is to educate people so that nobody should go to that level where they need a kidney transplant and they run around here and there to find an organ. Now, coming back to this World Kidney Day, if you look at this picture, the drawing more attractive. The red one definitely indicates the blood. That means the kidney take care of the blood. The blood enters the kidney, and in the whole body, the only organ which filters the blood is the kidney, and those ultimately will go to the kidney and block the arteries. So the three important causes of acute kidney injury is bleeding, malaria, and of course another bleeding of low bill. Suppose somebody having severe diarrhea, severe vomiting, losing lot of fluid in the body, they also develop acute kidney failure. But why I'm telling they are not important, because they're reversible. Once you treat them for low blood pressure, once you give them enough fluid, once you replace the blood, automatically they recover. But they may need few dialysis, maybe for 1 week, 10 days, 15 days, but ultimately they recover. But what Madam said just now, that's chronic kidney disease. Chronic means it's an irreversible thing. It doesn't, the function doesn't come back. So that is where the World Kidney Day is concerned mostly on CKD, chronic kidney disease, not on AKD.
Head of the Department of Medicine, to give closing remarks. Speaks already written regarding my world days already on the aspect to say, but I want to highlight two, three important points. Prevention. What is prevention? Primary prevention and secondary prevention. Primary prevention means before the disease occurs. That means for developing CKD, you have to pre it. And after developing this, you have to do all the disease. That is the second prevention. And disorders, Madam and Sir has already described diabetes, hypertension. We have to be careful while we prescribe the medicines, not only the painkillers but also about the other drugs, because all the drugs have some amount of side effects. Without side effects, no drug is available in the market. I hope, if I am not. So that every physician, every surgeon has the responsibility to while we prescribe, we have to take care of this. We have to prescribe optimum. If it is needed for 3 days, you have to give it 3 days, not the 5 days.